The COVID-19 pandemic has compelled government officials in the US and around the world to institute social distancing policies, mandate facial coverings in public spaces, and shutter much of the economy. While these public health policies were implemented with the support of public health officials, however, here in the US they quickly became politicized and were subject to a widespread backlash. The party cues that Pennsylvania residents in particular received about COVID-19 grew more polarized between April and June. In response to these conditions, this study investigated two key concerns about the public's reaction to the government's novel coronavirus policies: the effect of political polarization on receptiveness to public health policies, and resistance to messaging from elite sources. The study tested these possibilities using novel data from two online questionnaires with embedded experiments, administered by the polling firm Civiqs. They sampled from a panel of about 16,000 Pennsylvania residents, surveying approximately 2,000 subjects per questionnaire. Study 1 was conducted in early April and Study 2 from late May to early June. First, the study examined whether Americans only support such disruptive policies when recommended by politicians from their own political party. The surveys revealed partisan differences in views on several COVID-related policies, which grew more apparent between April and June. Yet overall, in Study 1, respondents reported strong support for social distancing policies and high levels of trust in medical experts. This partisan divide is also evident in respondents' political priorities, which experienced similar widening over time. A second related concern is that some may resist advice from so-called elite sources. To test this, the study attempted to determine who credible messengers are when it comes to COVID-19 and related policies. An experiment in Study 1 found no evidence of reduced support for social distancing policies when they were advocated for by elites, broadly defined as public health experts, government officials, and the media. Critically, the results also showed no evidence of differing impacts of the elite cue between Democratic, Republican, or independent respondents. A second experiment in Study 2 tried to disentangle responses to those different elite groups and found no respondent bias against a policy described as being promoted by public health experts. However, it did find a cross-party decline in support for the same policy when it was instead backed by government officials, even as compared to a neutral control policy. While external validity remains a key question, these results reinforce the idea that, in times of high political polarization, medical experts may be more effective advocates for such far-reaching public health policies than government officials. The authors are grateful for a timely and constructive review process from the Journal of Behavioral Public Administration. They are also grateful to the Leonard Davis Institute, whose Rapid Response Grant provided funding for the study. To learn more about this study, see media coverage from the Philadelphia Inquirer, published May 5th and shown here, or listen to the WHYY Radio Times May 7th episode, Night Theater.